Welcome to our EBP presentation. This is the Ugur Friday group.
This is Sarah. I had the opening and clinical inquiry slide. When a patient is admitted to the hospital for any number of days, the ultimate goal is to stabilize their condition, manage their symptoms, and be able to discharge them safely. During their stay, they'll see nurses, doctors, and just a whole bunch of people from a healthcare team. But depending on the hospital and unit, they may or may not be able to have visitors. It just kind of depends. So knowing this, we want to determine how visitors affect patient recovery rates. I also had the clinical problem identification slide. In the past, patients have expressed that having visitors improves their mood because they feel more supported, encouraged, and they just have a better desire to remain compliant with their treatment plans. And patients without visitors might feel more isolated and discouraged, which could leave them scared or sad. And most hospitals will allow visitors, but it's not always guaranteed, maybe in an ICU or locked units or where there's isolation precautions. So since there isn't a clear determination of how visitors affect patient recovery rates, there isn't really a perfect way to plan visiting hours. And since each hospital has its own rules, we want to find evidence to see how visitors affect patient recovery overall. And we ultimately want to determine if the pros outweigh the cons, so we can see if patients should get more or less visiting time.
This is Madison. I did the PICO question slide. Our PICO question is, in adult patients admitted to the hospital, how many visitors compared to no visitors affect patient recovery rates?
My name is Elisa Rizzo, and I had literature review of Article 1 and 2. So in Article 1, a study was conducted where researchers focused on patients who had just gotten out of surgery before and after their hospital stopped letting visitors in due to the COVID-19 pandemic. So the study included 58 patients who had a visitor after their surgery and 59 patients who did not. What researchers found was that patients who could have visitors were much happier. They took their medicines on time, and they were more likely to get out of bed with extra help. Researchers also heard that patients with visitors were more hopeful and in better spirits after surgery compared to those without visitors who felt lonely and isolated. Overall, the study supports the PICO questions as it showed the patients with visitors often had faster recoveries due to the extra care and attention that they received. And for Article 2, in Article 2, researchers surveyed more than 1,000 Chinese hospital patients and their visitors during the COVID-19 pandemic. Despite families following the new visitor rules, over half of the patients reported feelings of anxiety and loneliness. The study wanted to prove that visitors were more likely to comply with the new visiting rules when made aware of the theories behind them. The rules, however, helped control the spread of COVID and prevented patients from potential exposure. However, the decrease in visitors left patients feeling emotionally down. The study supports the PICO question as it proves patients prefer visitors during recovery for comfort, leaving the author to argue the need for further emotional support for patients when visitors are not allowed to prevent slower recoveries.
My name is Holly Gluck, and I did the literature review of Article 3. This article was done by St. John Fisher University, and it examined how visitation policies influence the physiological well-being of patients admitted to intensive care units. The study highlights how support systems play an important role in maintaining mental health during hospitalization. The study found that allowing visitors can help reduce anxiety, stress, and feelings of isolation. And ultimately, the study concluded that improved mental health can contribute to better patient outcomes. So this study supports our PICO question as it explains how visitation during a hospital stay has a positive effect on patients' mental health as well as their overall health outcomes. I also did the literature review of Article 4. This study compared 40 patients who were not allowed visitation with 40 patients who were. The study found that patients without visitors experience higher rates of disorientation, agitation, and greater uses of physical restraints compared to patients who were allowed visitation. So, with this, researchers concluded that the presence of family provides emotional support and ultimately improves patient outcomes. So, this study relates to our PICO question as it supports that visitor presence supports patient recovery by reducing stress, which ultimately prevents complications during their time in the hospital.
This is Madison. I also did Article 5. In this article, a study of 370 hospitalized older adults was conducted, focusing on the impact of the presence of family members on mental health. The study revealed that in independent older adults, longer family stays provided a stress barrier, which significantly reduced the development of depressive symptoms in those patients. One of the caveats of the study, however, was that it didn't include dependent patients, who tend to experience more chronic and severe symptoms while they stay in the hospital. The findings of the study suggest that hospitals should highly encourage the presence of family members for hospital stays, seeing as it can have significant positive impacts on a patient's mental health. This study supports our PICO questions, indicating that family visits have a positive impact on patient recovery rates, which are influenced by mental health recovery. This is Madison. I also did the synthesis of literature slide. A common theme throughout all of the reference literature, Articles 1 through 5, is the emphasis of the positive impact that having visitors has on patients while they are hospitalized. The studies include several types of patient populations, ranging from intensive care to patients during the COVID-19 pandemic. All of the included studies emphasize the positive influence of family and friend presence on the mental health and outcomes of patients while they reside in the hospital.
My name is Kendall, and I did the implementation plan slide. So what we decided on to implement a plan to help increase visitation during a patient's stay in the hospital is to make a plan to simplify visiting hours. With simple visiting hours, it would make it easier on family and friends that have jobs or that live further away to come visit their family in the hospital. We could improve parking access and ease of navigation to the unit. We could provide parking vouchers so that family doesn't have to pay for parking, and we could have obvious maps and signs to point family and friends in the right direction. Upon admission to the unit, patients could be briefed on the benefits of a support system and asked to provide contact information for any family members or friends that could be potential visitors. This way, it's a little easier on the patient, and if they know the benefits, they might be more willing to contact family or friends, and that way we have their contact information if the patient is not able to. We could also host themed visitation days, such as holiday or cultural celebrations, to possibly encourage visitation. If family has a fun reason to visit, that could increase visitation. Another thing we could do is partner with service organizations such as service dogs, music therapists, or just volunteer visitors for patients without a support system. That way they can still get the benefits of visitation in the hospital. Some benefits to the patients that have been proven based on our literature reviews and the studies that we followed are that patients can have emotional and psychological support from visitors there, which can help improve outcomes. There's increased patient safety. There's more eyes on the patient if there's visitors, and the patient's family can help decrease fall risk by decreasing clutter in the room, helping the patient ambulate, and more. And there can be stress reduction, leading to decreased complications and quicker recovery. There is plenty of evidence suggesting that stress reduction increases patient outcomes in the hospital, so having visitors can help with that stress reduction.
Hey, this is Corbin Sperling. Visitor presence plays a meaningful role in how adult patients recover during hospitalization. When visitors are allowed, patients often experience lower anxiety, less confusion, and greater emotional comfort, which can support healing. Family members can also act as advocates, helping communicate needs, clarify decisions, and ensure care aligns with the patient's preferences. This can support satisfaction, reduce agitation, and even contribute to shorter hospital or ICU stays. On the other hand, When visitors are restricted or absent, patients may face loneliness, distress, and a reduced sense of security, all of which can negatively affect recovery. Communication gaps can emerge, leading to delayed decisions or unmet needs. Strict policies, especially during events like the COVID-19 pandemic, have linked to increased emotional harm and reduced quality of care.
So, in order to evaluate our outcomes, we are going to use patient recovery metrics, staff observations and compliance, patient satisfaction scores, and a comparison timeline. By patient recovery metrics, we mean we are going to compare the average length of stay in the hospital, the complication rates and readmission rates before and after the implementation of our plans, which is expanded visitation. We are going to also collect feedback from nurses and healthcare staff regarding patient engagement, cooperation with care, and adherence to treatment plans. By patient satisfaction scores, we mean we're going to analyze hospital consumer assessment of healthcare provider and system scores, specifically questions related to emotional support and overall experience, which ties into expanded visitation. And then we are going to use a comparison timeline to evaluate data at baseline, like right before we start our implementation of expanded visitation, at the 3-month mark afterwards, and 6-month mark post-implementation, to identify trends and effectiveness of our experiment.
To help us ensure the long-term sustainability of our initiative, one of the things we would do is have policy integration by incorporating flexible visitation guidelines into the standard hospital policy can help us ensure long-term continuation of it, even as changes come up along the way, such as leadership changes, for example. Another thing we would have is provide staff education and training. It's very important that healthcare providers understand the value of visitor support and patient recovery. And by providing ongoing education, we can further help reinforce this mindset and promote consistent practice across different teams in the hospital. And lastly, we would do continuous monitoring to ensure that our intervention is remaining effective. And by routinely evaluating patient outcomes and satisfaction, we could identify the areas that are working well and the areas that need improvement. Together, by using these 3 strategies and including them into everyday practice, we can help make it sustainable and impactful in the long run. To help us
These are our references. Thank you for watching our EBP presentation.